Good morning. Today we are going to revise the topic benign lesions of oral cavity. We will go through some multiple choice questions about this topic and we will be discussing this topic in brief. The first question is differential diagnosis for exostosis are. What is the differential diagnosis for exostosis in the oral cavity? Is it fibrous dysplasia? You will be confusing this fibrous dysplasia with the exostosis or Paget's disease or any bony hyperplasia due to any chronic periapical abscess or all the above. So the answer is, so what is the differential diagnosis for exostosis? Means anything that causes bony swelling will will be covered under the differential diagnosis of exostosis because they resemble the exostosis in the initial stages at least when they are very mild, when there is starting of the bony swelling. So the answer will be all the above. Like in the case of fibrous dysplasia, when it is in the just starting stage, initial stages, Paget's disease, and also any bony hyperplasia due to any chronic periapical abscess. That is, there will be a localized swelling which will mimic the exostosis. So the answer is all this come under differential diagnosis for the exostosis. The next question is which of the following is not a structural variant of jaw bones or any oral soft tissues? Which is not a structural variant. All others are structural variants, that is normal anatomical structures. The first option is fissured tongue or circumvallate papilla on the tongue or tori or sublingual varicosities. Which of the following is not a structural variant? The answer is fissured tongue because circumvallate papilla on the tongue also will be like clinically appear as swollen papules like on the tongue, but they are not normal structural variants, normal anatomical structures present on the tongue. Tori are also normal and sublingual varicosities are also normally seen in the sublingual below the tongue. Next question is which of the following is not an inflammatory hyperplasia of the soft palate? All other options are inflammatory soft tissue hyperplasia except one. What is that? The first option is peripheral giant cell granuloma or fibroma or peripheral cementifying fibroma or verruca vulgaris. So among this, which is not because of the inflammation, which is not a hyperplasia of the soft tissue, but it is not due to just inflammation. So it is the cause is any something else. So answer is verruca vulgaris. Here the human papilloma virus is the cause for the appearance of verruca vulgaris, but not just the inflammation. Next question is peripheral cementifying fibromas are found exclusively on. So peripheral, it is not central, not within the bone. So peripheral cementifying fibromas are most commonly found on, exclusively found on the gingiva. So most common site of occurrence of these fibromas is gingiva. Next question. Which of the following is not an inflammatory hyperplasia of soft tissue? Again we discussed previously. So this is also a not inflammatory hyperplasia of soft tissue. Squamous papilloma or fibroma or epulis fissuratum or pyogenic granuloma. Among this, which is not just the inflammatory hyperplasia? Answer is again squamous papilloma, which is again caused by HPV virus, that is human papilloma virus. Next question is inflammatory hyperplasia of oral soft tissues may be due to. So what are the different causes for the inflammatory hyperplasia of the oral soft tissues? Ill-fitting dentures, cheek biting, caduceus or all the above. The answer is all this will cause the hyperplasia of the soft tissues. Next, inflammatory gingival enlargement may be due to. Is it because of the impaired collagen synthesis? Is it because of mouth breathing or vitamin C deficiency or all the above? So which among these three will cause the inflammatory gingival enlargement? Or all of the above will cause? What is the answer? The answer is all the above. Next, gingival enlargement is seen typically in maxillary anterior region. In which case? Is it bruxism that causes gingival enlargement in the maxillary anterior area, or mouth breathing causes, or bottle feeding, or all the above? So what is the answer here? The typical gingival enlargement, if it is present only in the maxillary anterior region, the reason is always mouth breathing. We should rule out for the mouth breathing habit of the patient. Next, lesions exclusively seen on gingiva are peripheral giant cell granuloma, peripheral ossifying fibroma or peripheral cementifying fibroma we also call, are both A and B, or none of the above? Which of the following is exclusively seen on the gingiva? So the answer is both A and B. Both these are seen peripherally, means not in the bone, that is on the soft tissues. So both these will appear mainly on the gingiva. Cobblestone appearance of the mucosa is seen in. This we have to remember. The typical appearance of the mucosa is seen in central giant cell granuloma or Cowden syndrome, peripheral giant cell granuloma or fibroma. So cobblestone appearance is typically seen in Cowden syndrome patients. Next, fibroma is seen in which of these? Like Cowden syndrome, tuberous sclerosis, both A and B, or none of the above. Where it is seen means it is seen both these diseases, that is Cowden syndrome and also the tuberous sclerosis. Multiple fibromas are seen. Next, drugs causing gingival enlargement are vitamin C supplements will cause gingival enlargement, or antibiotics, or convulsants, or all the above. So which of these drugs will cause the gingival enlargement means anticonvulsants is the answer. Vitamin C deficiency will cause the gingival enlargement, not the given supplements. Next, which of the following benign tumor is not associated with human papilloma virus infection? Which is not associated with human papilloma virus infection? We have discussed squamous papilloma already, that is caused by the HPV virus. Next is Hex disease or keratoacanthoma. Among this, which is not caused by the virus? The answer is keratoacanthoma. Next, in reference to lipomas, so lipomas recurrence is common with lipomas, or consist of immature fat cells, are more prevalent on the buccal mucosa and tongue, or all the above. So which of this is correct in reference to the lipomas? Only it is more prevalent on the buccal mucosa and the tongue, because it consists of mature fat cells, not immature, and recurrence is not common in lipomas. Most of the time there is no recurrence, will not occur if the lipoma is removed completely. Next, central giant cell granuloma and peripheral giant cell granuloma differ by which? What is the difference between these two? Is it rate of recurrence of these lesions, or tissue of occurrence, or histological features, or all the above? So what is the difference between these two? Mainly the difference is the tissue of occurrence of this disease. That is, central giant cell granulomas will appear within the bone, whereas the peripheral giant cell granuloma occurs in the soft tissues. Mainly, as we discussed, it occurs mainly on the gingiva. Next, following benign lesion of bone regresses by puberty. So which of these will regresses means disappears by puberty, heals by itself? Is it Paget's disease, cherubism, or fibrous dysplasia, or both B and C? That is cherubism and fibrous dysplasia. So answer is that is both B and C. Cherubism will also regresses by puberty age, and also fibrous dysplasia. They occur in the young age and they will disappear by the age of puberty. Following are suggestive of Paget's disease. High levels of serum alkaline phosphatase is present in Paget's disease, or urinary levels of the proline and hydroxyproline are increased, or radiographs show radiolucency, or mixed appearance, that is radiolucent and radio-opaque areas will be seen in the Paget's disease. Is it correct about Paget? Which of this is correct? Or all this will appear? The answer is all the above. Means in Paget's disease we are going to see high levels of serum alkaline phosphatase and also high levels of urinary levels, proline and hydroxyproline, and radiographically it may be radiolucent or mixed appearance. Next, fibrous dysplasia. So it radiographically shows ground glass appearance, progresses from childhood to puberty, and merges with the surrounding normal bone, or all this will appear in the fibrous dysplasia. The answer is all these are the characteristic features of fibrous dysplasia which will help in the diagnosis. Next, central giant cell granuloma is more common in mandible anterior to the molars. Histologically shows giant cells, extravasated RBC, and also hemosiderin deposits. Differential diagnosis includes hyperparathyroidism or all the above. The answer is again all the above, because it is most commonly seen in the mandible anterior to the molars. In the anterior region of mandible it is more common. Histologically it shows giant cells as the name indicates, and also it shows extravasated RBC and also hemosiderin deposits. This is typical feature and also differential diagnosis, because it is clinical, radiologically it appears as a radiolucent lesions and mimics the hyperparathyroidism. So differential diagnosis includes hyperparathyroidism. Next question is aneurysmal bone cyst. Is it a false cyst or it appears radiologically unilocular or multilocular? It affects mandible more than the maxilla or all the above. Again, the answer is all these features are common with aneurysmal bone cyst. More common in the mandible. It is a false cyst. There is no epithelial lining present with this cyst in the bone and affects mostly the mandible, and radiologically it is unilocular or sometimes even multilocular with the septations, like the septations are also seen within the cyst. Next question is increased serum alkaline phosphatase levels may be seen in cherubism, fibrous dysplasia, hyperparathyroidism, or all the above. As we discussed, this is in all these diseases because there will be like degeneration and regeneration of the bone is occurring. So this enzyme levels will be increased in the serum. So answer is all the above. Next question is differential diagnosis of Paget's disease includes what? It includes Albright syndrome, florid cemento-osseous dysplasia, cherubism, or both only A and B, like Albright syndrome and florid cemento-osseous dysplasia. So the answer is both A and B because cherubism will disappear by the age of puberty. It is the disease of children. So with this we easily can be ruled out for Paget's disease. So these two will be seen involving the many bones like florid cemento-osseous dysplasia also involves many apart from the jaw bones, it involves other bones also, and even in Albright syndrome we will be seeing the fibrous dysplasia involving multiple bones. So both these has to be ruled out to diagnose a case of Paget's disease. Next question is osteitis deformans is it is a chronic disease of bone or it is a common site is periapical region of the teeth, occurs as solitary lesion of jaws or all the above. What is the answer? That is nothing but osteitis deformans is nothing but Paget's disease. So characteristic feature of this is it is mainly the chronic disease of bone. So common site is periapical region of tooth is wrong because it appears as a generalized and involves all the bones, not just the jaws. So occurs solitary lesion of jaws is also a wrong statement about the osteitis deformans. So the answer is it is just chronic disease of bone about this disease is correct. Next question is aneurysmal bone cyst. So it affects individuals in second or third decades of life, grows slowly and root resorption is rare. Enlargement of the bone is common. So the answer C is all the above. All these are common with the aneurysmal bone cyst. Next question is bilateral involvement of jaw bones is seen in cherubism, peripheral genital granuloma, ameloblastoma or all the above. So bilateral involvement is common in cherubism. We see in children both the jaws will be expanding. That is common. Whereas in peripheral genital granuloma it appears in the mandible and in the anterior region, and ameloblastoma typically is unilateral. Most of the time it is unilateral only. So the answer is cherubism is characteristically seen as bilateral involvement. Next is Albright syndrome. It is associated with what? As we discussed, it is associated with hemangioma or fibrous dysplasia or vascular malformations or Paget's disease. What is the answer? The answer is fibrous dysplasia. Next question is benign fibroosseous lesions of bone include. What are the different fibroosseous lesions of the bone that are benign to the bone? Fibrous dysplasia, cementifying fibroma or cementosseous dysplasias and all the above. So all these are the fibroosseous lesions of bone. Next question is drug-induced gingival enlargement typically is. It is caused by chronic drug intake and it starts with enlargement of the interdental papilla. It is extensive gingival enlargement even leads to the disfigurement or all the above. So all these are common to the drug-induced gingival enlargement. All these are seen in these patients. Thank you. Thanks for watching this video. And this is just a brief revision of the topic. And you can go through all the topics that are covered in each and every question so that you will complete the revision. Thank you.